And right now, 13 Action News Live at 6:30, relieve, respond, and revive. 13 Action News is helping our community bounce back in our new series titled The Rebound Las Vegas. And all new tonight, people convinced they had the coronavirus now want to help protect others from it.
But getting tested for antibodies and then being able to donate plasma has not been easy around here. 13 Chief Investigator Darcy Spears shows us why this possible path to rebounding from this pandemic has been full of obstacles.
I'm convinced
that we had it.
Yeah.
Monica and Brian Ursua are two of many people who've reached out to 13 Investigate since we got confirmation from the Nevada Health Response there were earlier cases than the first positive reported in Nevada on March 5th.
It was during CES in December, the day after Christmas. We started building the Samsung booth.
Brian is a convention teamster who got seriously sick in early January.
And you were fighting these symptoms and dealing with the illness for about a month?
Yeah, it seemed like it was forever.
Monica came down with it about 2 weeks after her husband.
Like when you laid down in bed, it felt like somebody was sitting on your chest. That's how hard it was to breathe. And every time you took a breath, you coughed.
She went to the doctor with a fever too, but tested negative for the flu.
You guys are pretty well convinced that you're survivors.
Yes.
Oh, yeah.
Yes, I would like to get tested for the antibodies and help out where I can.
They're potential donors waiting in the wings, but not knowing where to turn. Antibody testing can show if someone's been infected in the past, but not when. It isn't widely available in Nevada yet. The health district talked about their plan for the first time on Wednesday.
The platform that we already have in-house that we will be putting the antibody testing on is already set to go. Not open to the public yet. We still have to validate that. But the sensitivity and specificity for this test that we're bringing in is 95 to 99% sensitive and specific.
The health district expects to have antibody tests ready to roll out by the end of next week. As for who will get them,
it'll probably be a mix still of our strike force teams doing targeted hotspots and targeted population groups with both the nasal swabs as well as the antibody tests when ready.
UMC's lab will launch coronavirus antibody testing on May 30th. Those who've completely recovered from coronavirus may have immune-boosting antibodies in their plasma, called convalescent plasma, that could be used to help treat critically ill COVID-19 patients. Historically, convalescent plasma has been used as a potentially life-saving treatment when new diseases or infections develop quickly and no treatments or vaccines were available yet. Dr. Mark Kahn, dean of UNLV School of Medicine, says it's the best tool we have right now to fight the disease.
Right now, our convalescent plasma donations are our first priority.
UNLV is partnering with UMC and Vitalant to collect convalescent plasma.
Since it's the only FDA-approved antibody treatment available right now, it's so important that those that have been diagnosed with COVID-19, who are fully recovered for at least 14 days and meet all of the eligibility requirements, that they apply on our website, vitalant.org/COVID-free, so that these donations will be given directly to our Las Vegas Valley hospitals to the patients that are critically ill and that need these immune-boosting antibodies.
If you want to donate convalescent plasma here at Vitalant, you have to have one of two things: a confirmed positive test for COVID-19 or a confirmed antibody test, which getting that is harder than you think and now has to be FDA approved.
Earlier this week, the FDA changed previously relaxed rules to make antibody test approval more stringent. That, after self-regulation, resulted in inaccuracies as high as 40% across the country.
We have to make sure that they work and give you the correct result before we're going to use them in the population. And it takes some time to actually do that. So tests are starting to come on the market. It just takes a little time to get to that point, and it isn't happening as quickly as people would like, but that's kind of the natural process of making sure we have a test that gives you a meaningful result.
UMC officials are still determining how many antibody tests the hospital will be able to process. Brian Labus says there are still a lot of unknowns in the medical community.
Well, we really don't know how long the antibodies last inside a person. We don't know if this is going to provide lifetime immunity or if the antibodies can fade over time and you could get this virus again.
UMC's antibody test will be a simple blood draw with an answer by the next day. Dr. Khan says UNLV has partnered with a private company that does a finger stick test and can have an answer within 10 minutes. That is awaiting FDA approval for emergency use authorization, which could come any day. Khan says UNLV will purchase several thousand of those finger stick tests, and they hope to work with hotels and casinos first to give employees and employers peace of mind, as antibody-positive people are safer to go back into the workforce. But Dr. Mark Pandori, director of the Nevada State Public Health Laboratory, is more cautious.
When you're reactive or positive on an antibody test, it's measuring that you have antibodies, but that may not correlate with immunity at that moment either. Your immune system is far more complex than just antibodies.
The Nevada Public Health Lab at the University of Nevada, Reno is doing antibody tests right now, but not for the public and not to identify convalescent plasma donors. It's functioning like the coronavirus CIA, gathering public health intelligence to use in the war on COVID-19 with hopes to have some good intel by the end of May or early June.
And to use the test to look at the population and see how much of this virus really came through here, because that's going to help us when we start to consider reopening, because we'll know, wow, it was really here for quite a long time and we didn't realize it.
He says that could shed light on the virus's true impact.
Because if we find out that a much, much larger proportion of the population was infected than we realized, then we know that that fatality rate is actually much lower than we're calculating currently. That is not to minimize the danger of it, but at least to put it into perspective.
If you think you've recovered from COVID-19 but don't have a confirmed test, you can still donate through the Red Cross. It will test convalescent plasma from qualified donors for COVID-19 antibodies. The Red Cross of Southern Nevada says 20 to 30,000 people have signed up so far, but most didn't qualify. They hope that changes as time progresses. If you do qualify and end up donating, the Red Cross says no news is good news. If you're positive, you won't hear anything. If you're negative for coronavirus antibodies, they'll send you a letter in the mail letting you know that they'll use your donation for other purposes. We have links to Vitalant and the Red Cross on our website. Go to ktnv.com. Darcy Spears, 13 Investigates.